This recording will go over antidysrhythmic drugs. A dysrhythmia is any deviation from the normal rate or pattern of the heartbeat. For pharmacology purposes, we're not going to go into the different types of dysrhythmias, so you just need to know that it's what it is. It's a deviation from normal rate and pattern of a heartbeat. You should be familiar about repolarization and depolarization from A&P, right? But I'm going to be very specific about what I want you to know about these antidysrhythmics. So if you look at table 37.5, you have a box that lists the different classes of antidysrhythmic medications along with their actions. I am not at all worried about you knowing the indications and the different types of dysrhythmias because you're going to cover that later in MedSearch too. For our purposes, I want you to understand the classes and the actions. What do they do? And then I'll give you a prototype for the different classes. So let's start out with the first one, class 1, sodium channel blockers. So you have 1A, slows conduction, prolongs repolarization. 1B, slows conduction, shortens repolarization. 1C, prolonged conduction with little to no effect on repolarization. So in terms of those class 1 sodium blockers, you need to know sodium channel blockers, you need to know what they are, sodium channel blockers, and then what each different class 1A, 1B, or 1C, what it does to the heart that's provided there. And here you have the medications that I want you to know. So again, we're talking about sodium channel blockers, your class 1 antidysrhythmics. Sodium channel blocker 1A works by slowing conduction and prolonging repolarization. The drug you need to know is procainamide. Sodium channel blocker 1B works to slow conduction and shorten repolarization. The drug you need to know is lidocaine. Sodium channel blocker 1C prolongs conduction with little to no effect on repolarization. The drug you need to know is flecainide. Class 2 antidysrhythmic drugs are beta-adrenergic blockers. They work by reducing calcium entry, decreasing conduction velocity, automaticity, and recovery time. Your prototype class 2 antidysrhythmic beta blocker is acebutolol. Class 3 antidysrhythmics work by prolonging repolarization during ventricular dysrhythmias and prolonging action potential durations. The drug that you need to recognize as a class 3 antidysrhythmic is adenosine. Finally, class 4 antidysrhythmics are calcium channel blockers. They block the calcium influx, slow conduction velocity, decrease myocardial contractility or have a negative inotropic effect, and increase refraction in the atrioventricular or AV node. The calcium channel blockers that you should be familiar with are verapamil and diltiazem. In terms of the purple nursing process box for antidysrhythmics, I want you to know the nursing interventions. We need to monitor vital signs because hypotension can occur when administered drugs as prescribed. We want to monitor the ECG for abnormal patterns and to see if our medications are effective in changing the patient to a more normal rhythm. And then also in terms of teaching, we want to teach the patient to take medications as prescribed. Advise patients to avoid alcohol, caffeine, and tobacco. Alcohol can intensify a hypotensive reaction. Caffeine increases catecholamine levels, and tobacco promotes vasoconstriction. So let's move on to the practice questions at the end of the PowerPoint presentation. Go ahead and pause the video, read through the question, and pick out your correct answer, and then resume the video to see if you're correct. So for question 1, the correct answer is B as in boy. Side effect of nitroglycerin is hypotension owing to the vasodilation of blood vessels. Question 2. The correct answers are A, B as in boy, and C. The apical pause should be taken before digoxin administration and the drug withheld if the heart rate is less than 60. The patient's serum digoxin level should be monitored and withheld if in toxic range. Therapeutic level is 0.8 to 2. Patients should be advised to eat foods high in potassium. Patients should be advised to avoid taking antacids with digoxin because they decrease absorption. Question 3. The correct answer is A. A baseline pulse rate for the patient should be obtained for future comparisons. Apical pulse rate should be taken for a full minute and should be greater than 60 beats per minute. The prescriber should be notified if the patient's pulse is less than 60 beats per minute and the medication should be held. Question 4, the correct answer is B as in boy. A low serum potassium level enhances the action of digoxin and can cause digitalis toxicity. Question 5, the correct answer is C. The most common side effect of anti-anginal drugs is hypotension. Question 6, the correct answer is D as in dog. Dizziness, faintness, and headache can occur when taking nitroglycerin. It is important to teach the patient about avoiding complications related to orthostatic hypotension. Persistent pain indicates the possibility of acute coronary syndrome. Question 7, the correct answer is A. Diltiazem is a calcium channel blocker used to treat dysrhythmias. Esmolol, you see the LOL, you should recognize as a beta blocker. Flecainide is a sodium channel blocker, and another LOL, Sotalol, is a beta blocker. Question 8, the correct answer is D as in dog. Cardioselective beta blockers act more strongly on the beta-1 receptor, which decreases the heart rate but avoids bronchoconstriction. Atenolol is a cardioselective beta blocker.